Hi, it's Paul. In this clip I want to look at some of the more difficult and different appearances of metastatic adenocarcinoma in effusions. So in part 1 I looked at that classic appearance, and it's usually a pretty easy diagnosis, but there are a couple of traps, particularly in well-differentiated adenocarcinomas that present in effusions. These can either look like reactive mesothelial cells or even malignant mesothelial cells. First pattern I want to look at really is a mucinous pattern. So some very well differentiated tumours, metastatic to the peritoneum especially, produce a lot of mucin and have really very little in the way of nuclear atypia. There is one condition that derives from this, which I'll talk about in the lecture, called pseudomyxoma peritonei, that can be quite difficult to diagnose. Here we have a diff-quick, and you can see a clump of mucus present there, staining kind of magenta-y and fibrillar in the Giemsa stain slide. Got a background of what appear to be mesothelial cells. Here's some more stringy sort of mucin with cells in amongst it. I'm not really sure, to be honest, what they are. I think they are probably macrophages, but they could be tumour cells. You can see how kind of fibrillar that mucin looks, and it's a matter often of searching around in these cases for some groups of epithelial cells that are not mesothelial. Here's one, and often these won't have a whole lot in the way of nuclear atypia, so notice these are pretty uniform. They've got pretty prominent nucleoli, but so the key feature of this really is recognizing that background mucin that's present in the case. Here's another case, and so not all adenocarcinomas present in very cohesive balls of cells and acini. This is one that's showing less cohesion, and so there are more sort of singly arranged cells, and this can be quite tricky. Notice I've got marked nuclear atypia here, and I've got variation in nuclear size and shape, quite a big one in the middle there. And then if you look around, these cells aren't really mesothelial, so I can't see windows in between them. And if I look at this group here, notice the edge of the cells are not in fact frilly at all, lacy. So these are not looking like mesothelial cells to me. It's also hard to judge on a Giemsa, but I think these are quite hyperchromatic. So I'd be really wanting to check that out in detail on the pap stain. And I'll be looking around for vacuolation that would be not typical of mesothelial cells, and for groups of cells that are not showing windows. These just not looking right for mesothelial cells to me. This is a pap stain. It's also pretty dispersed. I can't see too many groupings of cells here. On high power again, there's probably more variation in nuclear size than I'd want to see for mesothelial cells. It's quite a big one there. And notice that the cells don't have that lacy border also. And I'm looking around for where cells meet. Is there any windows? And I can't see that typical cell-cell apposition, as it's called. That's typical of mesothelial cells. There is a vacuole. It has like a hard edge to it, and that's quite a suspicious finding in view of all the other findings. So I'm very suspicious this is a single cell presentation of adenocarcinoma. Another nice hard edge vacuole there. You shouldn't see them in mesothelial cells, and this is typical of some types of lung, gastric and breast carcinoma especially. They will present. Here we've got a couple of big hard edge vacuoles in that cell there. Finally, here's another case, quite bloody, very dispersed looking cells. Can't see too many groups at all. Possibly one here. and quite a large cell there, so that's quite suspicious as well. On high power it's got possibly 2 nuclei, but very large nuclei with coarse appearing chromatin, got very prominent nucleoli. It's a little hard to evaluate whether these are mesothelial or not, but I'm thinking that they're probably not. And this group are quite suspicious, so that big clear area is probably a vacuole, really large nuclei, and so that degree of atypia is not normally seen in reactive mesothelial cells or the vacuolation. So I'll be quite interested to see how the PAP slide looks in this case. That's probably going to be quite helpful. Another group of cells there, so I'm thinking this is adenocarcinoma. And this group is certainly looking glandular. See how the nuclei are arranged around the outside down the bottom there? They've got prominent nucleoli. This is the PAP stain slides, and again quite dispersed. Some large atypical nuclei, probably groups here. So this one is a matter of scouting around a bit really to find those features, and also to rule out this being mesothelial. These are fairly dense groups. They don't appear to really have windows in them. They're not as organised as some glandular groups, but the main thing I'm trying to do is to exclude these being mesothelial. And here's some vacuolation in the cytoplasm of a couple of these cells, so that's good supporting evidence for adenocarcinoma also. So, in summary, some of the less common patterns that are seen include highly mucinous, well-differentiated adenocarcinoma. Because they're well-differentiated, they'll show less nuclear variation, but mucin is a big clue. And then that single cell pattern, that can be very tricky, and it's often seen in breast carcinoma in particular, and immunohistochemistry is sometimes the sole way to sort that out. Sometimes you'll get just single cells, and these are the undifferentiated adenocarcinomas, so they'll show obvious malignant nuclear features, but will be harder to type from other types of malignancy that could be metastatic to the cavities.